just going to perform some hand hygiene real quick. Hi, how are you doing today?
Good.
Good. My name is Alicio. I'm one of the nurse practitioners. I'm going to be doing your comprehensive exam today. That just means that I'm going to be doing a few questions and a few exams. So we'll start off with, do you know where you are today?
Yes, the clinic.
Good. Do you know what month it is?
February.
And do you know who the president is?
Donald Trump.
Good. So patient seems to be alert and oriented times 4. She looks to be in great health, good hygiene, dressed appropriately, skin's intact, and looks to be consistent with her ethnic background. I'm going to go ahead and check her nails and skin. Skin seems warm and dry. Capillary refill is less than 3 seconds. So next I'm going to go ahead and palpate your skull. So you just tell me if there's any tenderness. Anything?
No.
Good. So skull is normal cephalic and atraumatic at this time. I'm going to go ahead and check your eyes, inspect your nose, and inspect your ears. They all look to be midline and symmetrical. Okay, perfect. I'm going to go ahead and check your eyes real quick. So I'm going to visualize the red reflex in the left eye. Red reflex is intact. Optic disc is sharp and well defined. I'm going to do it for the same eye. Optic disc is also sharp and well defined. I'm going to go ahead and test for pupillary reflex. So just go ahead and look at me. Good. And then just follow that. Good. Pupils are round and reactive to light with accommodation. Next I'm going to check for confrontation, so go ahead and cover your left eye for me. And then you're just going to tell me how many fingers you can see, okay?
2.
Good.
2. 1.
Okay, go ahead and cover your other eye. Thanks.
2.
Good.
1.
Good.
2.
Good. Perfect. We're going to check for cardinal fields now, so you're just going to follow my fingers only with your eyes. Okay, perfect. No visual loss there. Cardinal signs are intact. So now I'm going to check your ear. I'm just going to palpate real quick the tragus. Any tenderness?
No.
And the auricle? Any tenderness?
No.
Good. I'm going to go ahead and inspect your ears now by placing the otoscope inside. Tympanic membrane is visualized, pearly and gray, with the cone of light in the proper position. And same on both sides. Good. So now we're going to check your mouth real quick. I'm just going to ask you to say ah for me. Okay, uvula is midline and rises with phonation. So I'm going to go ahead and check for swallow in your gag reflex. Go ahead and open your mouth for me. Good. Gag reflex is intact. And I'm going to go ahead and ask you to open and close your jaw. Good. No abnormalities there. So I'm going to go ahead and check your neck for jugular vein distension. Doesn't look to be any at this time. Trachea is midline, and thyroid is in the correct position. I'm going to go ahead and auscultate your carotids and check for any bruits. No breweries noted. I'm just going to go ahead and palpate both sides. Carotids are at a 2+ with no thrills. I'm going to check your nose real quick. I'm going to go back to the nose, okay? So I'm just going to have you look up real quick. Both nares seem to be patent bilaterally. Turbinates are smooth, pink and moist, and there is no septal deviation. So now I'm going to check your lymph nodes. I'm just going to go ahead and palpate around your head and your neck. You just tell me if there's any tenderness.
No.
Any tenderness?
No.
Good. So no tenderness noted upon palpation of all lymph nodes. So I'm going to go ahead and auscultate and check your chest now. So AP diameter is 1 to 2. I'm going to go ahead and check for equal chest rise and chest expansion. Go ahead and breathe for me. Great. Equal. And then I'm going to check for tactile ferritus. Go ahead and say 99 whenever I touch you. 99.
99.
Good.
99.
Good.
99.
Perfect.
99.
Okay, great. So now I'm going to listen to you and auscultate posteriorly. You're just going to breathe out through your mouth. Good. 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 Okay. So now I'm going to listen to your chest and listen to all 5 precordial sites. First, I'm just going to go ahead and palpate the precordial sites. Okay. Now I'm going to listen. First one is pulmonic. Aortic, pulmonic, Erb's point, tricuspid, and mitral. And then I'll go ahead and listen with the bell as well, in same positions. Okay, good. And I will do this in a laying position again later. So I'm going to go ahead and palpate for the point of maximum impulse. Can you go ahead and lay down for me? So PMI is intact, pulse of maximum impulse is equal, no heaves, no thrills. So go ahead and lay on your left side for me. I'm going to go ahead and listen to you one more time with the diaphragm and the bell in all 5 precordial sites. All right, perfect. Thank you. Go ahead and lay on your back again. I'm going to go ahead and inspect your abdomen. Abdomen is flat. No abnormalities noted. Skin color is consistent as well with ethnic background. No discolorations noted. I'm going to go ahead and auscultate for vowel sounds in all 4 quadrants. Vowel sounds are normal active. I'm going to go ahead and listen to the aortic, iliac, femoral, and renal arteries. Renal, iliac, femoral. So no thrills noted as well. I'm going to go ahead and check for some abdomen movements just to check if you have any appendicitis signs. So I'm going to go ahead and you tell me if this hurts whenever I touch you, okay?
No.
Okay, great. So I'm going to go ahead and do light palpation first. Any tenderness?
No.
Okay. And then I'll do deep palpation in the same order. Any tenderness?
No.
Good. No tenderness noted there. I'm going to go ahead and do the psoas sign, which is where I have you lift your right knee and then just go against my resistance. Go ahead and lift your whole leg. Good. Any tenderness there?
No.
Any pain? Good. Nothing. So then I'm going to check for the Rothstein sign. It's on the left lower quadrant. Any pain or tenderness there?
No.
Okay, great. And then I'm going to go ahead and flex your knee, and we're going to check for the obturator sign. So, and then we're going to internally rotate your hip. Any pain?
No.
Good. All right. So now we're going to check the spleen. We're just going to go ahead and palpate. You can just tell me if there's any tenderness. Okay, great. So spleen is not palpable with no tenderness noted. And then I'm also going to check for your liver span and start percussing as well. Okay, so liver span is 7 centimeters with no tenderness noted. And then I'm also going to check for inguinal lymph nodes, not palpable. So go ahead and stand up for me, or sit up. I'm going to go ahead and check some cranial nerves at this time. I'll sit down. Okay, so cranial nerve number 1, I would check for smell. But at this time I don't have anything for you to smell. So I'm going to check for the optic nerve, which is cranial nerve number 2. The only thing I did not check is for visual acuity, which is with the Snellen chart. I already checked concentration in the visual fields. So you're just going to cover one eye for me, and then you're going to tell me the smallest line you can read.
IRRIGATE.
Great. Can you do the other eye for me?
IRRIGATE.
Great. So we also checked for cranial nerves 3, 4, and 6 already for your extraocular movements, and all of them were smooth and intact with no deviation or ptosis. So next, I'm going to ask you to check for cranial nerve number 5 and 7, which is to clench your jaw real quick. Go ahead and smile for me. Go ahead and stick out your tongue. Go ahead and puff your cheeks. Go ahead and close your eyes real tight. Great. Okay, cranial nerve 7 and 5 are intact. We're going to check for the Weber and Rene and whisper tests. So this is just cranial nerve number 8. So I'm just going to ask you to tell me when you can't hear anything anymore, okay?
No. No.
Good.
No.
So cranial nerve number 8 is intact. I'm just going to check one more thing, which is the whisper test. I'm going to go ahead and have you cover this ear for me. And I'm going to tell you to say, tell you to tell me what I say.
Elephant.
Great.
Hospital.
Great. Okay, so cranial nerve number 8 is intact. I'm going to check 9 and 10, which I already did, which is with gag, swallow, and your speech is clear, not slurred, no dysarthria. So I'm going to check for accessory nerve number 11, cranial nerve 11. So you're just going to go ahead and lift up your shoulders and shrug them real hard. Good. Go ahead and put your head to my hand. Good. Other side. Great. And then, okay, perfect. And then go ahead and stick out your tongue. Move this side to side. Great. Cranial nerve is 12 is intact as well. So I'm going to have you do one more test. It's called the Romberg. So you're going to go ahead and stand up for me. We're just going to check your gait, and you're going to go from heel to toe. And I'm going to see if you're steady. Okay, great. You can go ahead and come back to me. Okay, great. Romberg sign is intact. Steady gait. Now I'm going to check and palpate your spine, and we're going to inspect. Can you just tell me if there's any tenderness as I go along?
No.
Great. No mass is noted. Curvature of the spine is straight and aligned. No curvatures. And now I'm going to check some reflexes. You're just going to go ahead and touch my finger with your hand, and then touch it to your nose. Good. Other hand. Good. Perfect. Go ahead and squeeze my fingers really tight. Good. Go ahead and push me. Go ahead and pull me. Good. And then go ahead and go heel to shin. So you're going to do this. Great. Sorry. Thank you. Okay, perfect. Now we're going to do the Babinski. I would do this with her laying down and with her shoes off at this time, but for this purpose, her Babinski is negative. Now I'm going to go ahead and inspect your upper and lower limbs for strength. So you're going to go ahead and just follow my actions, okay? So do this. Go ahead and go down. Okay, go ahead and flex for me like you're lifting something. Perfect. Go ahead and extend out. Hyperextend. Great. And then go ahead and go like a soup bowl, and then go ahead and flip it over. Perfect. So supination, pronation, extension, flexion, hyperextension, abduction are all intact. I'm going to check for knee strength. Go ahead and lift your knee up for me. Great. Really strong. Okay, perfect. 5 out of 5 strength on the knees and upper and lower extremities. I'm going to check for the patella, and just make sure it's intact. So go ahead and lie down for me. Okay, good. And then just do this one for me, and then I'm gonna pull. Okay, any pain with that?
No.
Okay, great. So patella is intact, and then I'm just gonna have you stand up one more time, and I'm done. All right. So you're just gonna stand up really, really straight. Okay. So patient is standing straight up with no varus or vulgus noted, and that concludes my physical exam. Thank you.